Hi, my name is Angel Reed. My student ID is E0058136. These videos are for VTHT223. This is the fall semester of 2019.
Go. In this video, I'm going to show you how I'm going to perform a blood draw. I have a 6 ml syringe that's going to be according to how much blood I'm going to need, a 22 gauge needle. I have a serum separator tube and a lavender top tube because we will be sending this to the lab. And I have my patient and my holder. I'll be using a jugular vein, so now I'm going to do the blood draw. I'm just filling for his vein. Good boy. I'm going to use a little bit of alcohol. I don't want to poke you and make it so short.
This one, or was it AP, anterior to posterior? Even though it's cranial and caudal?
Yeah, you probably
So
want
DP
this
and
one.
AP are the same thing?
Good boy.
Okay.
He's got fleas.
And then whenever
What?
you're doing
He's got fleas. Okay.
This one, not the.
Good boy. Good boy. Good boy. Good boy.
Okay,
Good
so
boy.
I've did the jugular vein, so I'm going to slowly draw back. Good boy, Ed. Good boy. I'd like to get 6 mils. Good boy, we're almost done. Okay. All right, Jackie, so just hold that. Put it in my lavender top tube
When we're
so it
sending,
doesn't clot.
so you know lateral and medial.
And then into my serum separator tube, making sure I have enough.
Anyways,
And
you know lateral.
that's how I do a blood draw.
In this video, I'm going to demonstrate how to do a blood film. This is a peripheral blood smear. This is a good diagnostic tool. It's cheap. It backs up your CBC in-house lab. It's good information. It also looks for any parasites that might be in the blood. It's a very, very good tool to have. And I have gloves on to limit any contact with my sample, which is labeled with the patient's name. I have a 1 cc TB syringe with a needle on it. There's many ways to put your blood on the film. This is just one way that I find easier for me. There's definitely an art to doing this. And then I have 2 microscope slides. So now what I will be doing is I'm going to open up my sample. We use an EDTA coated tube. This just keeps the blood from coagulating. It also is a preferred thing to put your sample in due to it just helps keep the cells from lysing, things like that, and you don't want to use clotted blood because you won't get a good interpretation of your sample. So right now I'm just going to put my syringe into my sample blood. I'm not going to draw up that much. You don't want to put too much on your microscope slide. What I'll be looking for is a nice feathered edge. So right now I'm just going to take this. I'm going to go ahead and get it ready because again I don't want much. And I'm just going to take a drop and put it on one of my slides. Go ahead and put the cap back on my needle. I'm going to take my other slide, which is empty, and I'm going to be pulling back and waiting for my blood to make contact with the edge of my microscope slide. What I'm looking for here is a nice feathered edge because that is going to be what gives you your best results. It's a thin edge, so you'll be able to read your slide a lot easier to see if there's anything going on with your patient. So from here, I'm going to let it dry. I've actually got another one while I was practicing because again, you want a nice feathered edge, so I'll be staining both of them. And we're gonna let this sit here to dry and then do the second part of our video, which will be reading it under the microscope. So now it's time to stain our blood film. So I'm gonna bring it over here, and you can see we have two different types of stains. One is for ears and fecal matter. So to keep the contamination down, we're gonna use these stains, which is for like skin, blood smears, also fine needle aspirates. I'm going to start in the blue stain. This is going to fix it onto my slide. I usually dip it about 10 times. I'm going to get the excess off, and then on to our pink stain. Staining it is going to help you to be able to appreciate the different cells. Just makes your sample easier to read, especially when you're looking at white blood cells. Okay. Just getting the excess off. Go ahead and rinse it with just a little bit of water. And from here, I am going to let it dry a little better before I read it. It should be fixed on there, so just going to blot it around. Once this is a little bit more dry, I'm going to read it under the microscope. So now I've got my stained blood film on the microscope ready to be read. I'm going to start with the 40 power just to get it into focus, and then move up to my 10 power, which is still low power. Go ahead and read it. And I'm mainly looking at the feathered edge. That's why it's good to have a long feathered edge, so it's thin and you can differentiate between the red blood cells and white blood cells, platelets, and we're also looking for any parasites such as microfilaria, babesia, ehrlichia, things like that. You also want to make for sure you don't have any left shifts in any of the white blood cells, because that is, left shifts are definitely something to note. Okay, and from here I'm just going to go up another power. Go ahead and focus it. I'm not seeing much. Now I can really appreciate the white blood cells.
Don't you have to read?
And now I can move on to my oil immersion. So I'm just going to add a little drip into there. Probably more than I needed, but that's okay. So since I focused it at the other powers, it should be easier just to use my fine focusing. So overall I'm seeing about 3 to 4 white blood cells per high power field. There's definitely clumping of the red blood cells that could be from the collection sample. And that will end my observing the blood film under the microscope. In this video, I'm going to show how to run a PCV, which is a packed cell volume. It's going to tell us the amount of red blood cells to total blood volume, and it will let us know if our patient's anemic or dehydrated, so that just kind of helps the doctor know what kind of treatment they need, supplementation, or if we need to get them started on IV fluids ASAP. And also from there, I can read my total protein, which is very important. It just tells us if our patient has any nutritional needs that we can supplement them, proteins flowing around in their blood. So the supplies that I need, I have my gloves on just to limit my contact with my sample, which my sample is in an EDTA tube to keep it from coagulating. And we have our patient's name on here, so we're making for sure that we're running it on the right patient. I have my centrifuge, which I will be spinning down my hematocrit tubes in. I'm gonna need 2. And I have one as a sample and one basically as a counterbalance, but then you can compare the two, so it's good to run 2 of those. From there, I will be using my clay to make a plug in my hematocrit tubes, and then I'll be reading it on my easy reader. So this is going to tell me the percentages of my red blood cells. And then to run my total protein, I'll be using my refractometer. So now we're going to go ahead and make our sample. Just invert my tube a little bit just to mix my sample up better. So I'm going to start from the clear end of my tube. You can see there's a red line right there, so. And then I'm gonna be filling my tube about 3/4 of the way full. Okay. Now I'm gonna take this and put this in my clay stopper. I like to do it twice just to make for sure that it's gonna give me keep my sample from running out. So now I'm going to take this one and I'm going to fill it up the same amount. Let's see. Okay. And again, I'm going to use my clay to make a plug. Okay. Oh, that's almost perfect. And from here, I'm going to put it in the centrifuge, and you want to make for sure your samples are parallel. You want to make for sure that the clay portion is out. If not, your sample will go flying in and you'll have a big mess in your centrifuge. So now I'm going to take the lid, making for sure I don't crank it down too much because that can break your hematocrit tubes. So, and then I'm going to shut the lid and turn it on. This is going to run about 3 minutes. It's preset, so, and then we'll wait. So now our centrifuge has stopped spinning, so I'm going to take my sample. And you can see it spun down. We have the plasma on top, buffy coat in the middle, which is that white area right there. And then down here, I have my sample of my red blood cells. So I'm going to take my easy reader. I'm going to line my clay plug up at the bottom at 0, taking my hematocrit tube, and what I'm looking for is to line the plasma up at the 100% mark. My clay is at the 0. And I'm looking at the top of my red blood cell. So right here you can see it's pretty much about an even 40%. So I will document that on my patient's chart. This was coming from a sick patient, but it looks like that would fall within normal range. Your normal range is about 40 to 45%, so that's good for the patient. And from here I will document it and let the doctor know after doing my total protein. So now to run my total protein, I'm going to take my refractometer and I'm gonna break it at the Buffy coat mark, which again is that white area. So now I'm going to place a drop of my sample onto my refractometer. Making sure not to get any shards of glass on there. Now I'll put it up to a light source so I can read my results, which is going to be about 7.2. Okay, from here, I'm going to take a Kleenex, clean off my refractometer, and I will record my results and inform the doctor of both the PCV and the total protein.